at 10:50. I think Dr. Apurva is still left to put on the background. Dr. Apurva, are you able to put on the background now?
Audible now? Am I audible?
Yes, sir, you're audible now.
Okay, now I can see the three dots, and then
So when you click on it,
a change into virtual background. Okay,
yes, sir.
just give me a moment.
Yes. You will get an add option there. You can add the virtual background and then.
All right.
You see into that, no? After
Select, download.
Dr. Apurva, are you able to
Yeah,
do that?
just give me a minute. I'm just trying to do it.
Dr. Ababa,
I think I'm done.
Yes, you are. Yes.
Last
Yes, sir.
Thank you so
Finally.
much, patience.
So we'll start by 11. Before that, may I request all the participants to turn on the video so that we can do a quick photo. Dr. Apurva, may I request you to switch on your video? Ragini,
Yeah.
you're not in the center. Yes, sir. So, Ajanya, can you please switch off your other account for the moment?
Take a quick break, panel. I think let's not decide immediately. Just go
May
ahead.
I request everyone to be please be front and center? Dr. Apurva, we'll do a just we'll quickly do a photograph
Yes,
and then
I'm
we'll
audible.
begin at
Yeah.
11. Yeah, yes, sir. May I request the team to take the photos? No, sir. I'm requesting the team
Hello.
to take a photograph. Okay. All right. Thank you so much, everyone.
Teacher.
morning, everyone. A very warm welcome to all of you. And I would like to thank all of our panelists and the audience for joining us here today. As part of Nasha Mukt Bharat Abhiyan, the Ministry of Social Justice and Empowerment is marking the International Day Against Drug Use and Illicit Trafficking with a week-long summit. This webinar is one of the many exciting events scheduled throughout the week, and the summit will feature activities, discussions, and deliberations involving youth experts, academicians, government officials, and other key stakeholders in the field of substance use and drug demand reduction. The Nasha Mukt Bharat Abhiyan is this ministry's flagship campaign aimed at tackling substance use and addiction in the country. This campaign seeks to create a drug-aware India through a comprehensive strategy that includes prevention, treatment, and rehabilitation. Without further ado, I would like to introduce the theme of our webinar today, engaging university students to lead the drug-free campaign. Since the launch of this Abhiyan, universities have played a pivotal role in the implementation as well as spread. As hubs of education and innovation, universities are ideally positioned to spearhead and awareness campaigns, conduct research, and foster a culture of prevention and substance use. By integrating substance use education into the curriculum, universities can sensitize students about the risks and consequences. They can also provide counseling and support services, create a safe environment for the students seeking help. Additionally, universities can partner with government agencies and other civil society organizations to organize seminars, workshops, and outreach programs, extending their impact beyond campus boundaries. Through research, universities also contribute valuable insights into the causes and effects of substance use, aiding in the development of effective prevention and rehabilitation strategies. By leveraging their resources and expertise, universities have become crucial in the national effort to reduce drug demand reduction and promote a drug-free India. Moving further, I would like to invite Ms. Saujanya, State Coordinator at the PMU, at the Ministry of Social Justice and Empowerment, to give us a brief presentation on Nasha Mukt Bharat Abhiyan. Saujanya, over to you.
Good morning, everyone. I'm Saujanya Ambali, a PMU State Coordinator, and today I'm very glad to give a presentation on Nasha Mukt Bharat Abhiyan. In India, every citizen has a fundamental right to lead a healthy and dignified life, which includes leading a substance abuse-free life. Article 47 of the Indian Constitution directs the state to ensure it. To understand the extent and pattern of substance use in India, the Ministry of Social Justice and Empowerment conducted a national survey in 2018-19. This survey showed that approximately 7.3 crore people are the victims of substance use, which includes 58 lakh women and 1.2 crore children. The mostly consumed substance in India is cannabis. In order to combat this issue, drug demand reduction is considered as an effective tool in the entire world. And that is by focusing on three crucial areas. They are primary prevention of substance use, treatment, and integration. In the similar lines, the Government of India designed the National Action Plan for Drug Demand Reduction. It includes preventive education, awareness generation, identification, counseling, treatment, and rehabilitation of the substance users. Training and capacity building of the service providers, reducing stigmatization and discrimination of substance users. Now, it's time to delve deeper into the Nasha Mukt Bharat Abhiyan. The Nasha Mukt Bharat Abhiyan was launched on 15 August 2020 in 272 most vulnerable districts across the country. The campaign was wholeheartedly embraced by the people of India. Considering the success of this campaign, its implementation was extended to each and every district of India on 15th August 2023. The main objectives of the Abhiyan are to create awareness on ground, focus on achieving substance-free educational institutions, community outreach, building counseling, treatment, and rehabilitation facilities, capacity building of service providers, and focus on mental and physical well-being of youth and adolescents. Implementation strategy of Abhiyan includes three-pronged approach. That is, restraining the supply of drugs by the Narcotics Control Bureau, demand reduction by the Ministry of Social Justice and Empowerment, and building treatment facilities. For effective implementation, an NMBA committee have been formed at different levels, such as state, district, and municipality level. These committees meet regularly and review the activities that are conducted under the NMBA. Our objective of conducting on-ground activities is achieved through master volunteers. They are the local heroes. They come from diverse background and work for one cause. Currently, there are more than 8,000 master volunteers. Their potential is boosted by training them regularly using the material that is prepared by the ministry. Abhiyan has effectively reached out to large number of people. The number says that over 11 crore people are reached out through more than 3 lakh activities. Through activities conducted by members of women group, Jivika Didis, Asha volunteers, and Anganwadi staff, we have been able to reach out to more than 2.3 crore women of this country. We have been able to involve over 3 lakh youth through various activities conducted by Yuva Mandals, youth club committees, and also through social media interns and peer programs focused on substance use prevention. NMBA has covered over 3 lakh educational institutions by conducting various activities and competitions on themes of substance use. Education institutions have not restricted themselves to the campus boundary. Instead, they are working hard to create awareness in the surrounding community as well. They are building effective strategies which include indigenous ideas to create the participation of youth. To increase awareness among the local communities, such as Nukkad Nataks, sessions, awareness ruts, and even the painting spreading the message against substance use are drawn. Contribution of students in these activities are also worth acknowledging. Special focus is given to hotspots like slum areas. Identification of local people leading the campaign in vernacular language is being done. Regular engagements and involvement of recovered people in the campaign is promoted. National events such as NMBA interaction with the National Cadet Corps, addressed by Honorable Minister of Defense, Mr. Rajnath Singh, and a nationwide pledge-taking ceremony at educational institutions involving 1.67 crore students was organized. Apart from these, a spiritual angle was also given to this campaign by signing MOU with the religious or social service institutions to create mass awareness. This helped to promote use of yoga and meditation to overcome drug use. An NMBA mobile app and dashboard is created to keep a track of activities that are being conducted on ground. These are updated with the information and pictures of activities by the master volunteers, district officials, and also by some universities. An NMBA website was also created to connect people with the experts directly. It includes a national de-addiction helpline and dashboard, expert forum and discussion page, pledge for citizens, and also a citizens corner for feedback and grievances. I suggest everyone to visit the website and make optimum use of the resources available on it. 14446, the National De-Addiction Helpline. It is acting as a significant mode for primary counseling, as some people are hesitant to directly visit the counseling centers. Another factor promoting dependents to take the step towards de-addiction is anonymity, as no personal information of the caller is recorded during the call. And they could also get information of the nearest treatment facilities center. Till now, the helpline has received 4,02,590 calls, and majorly from youth. Regular content creation on social media about drug de-addiction, drug demand reduction, mental health, etc. in the most eye-catching form. That is reels, memes, guides, IEC posts, NMBA activities, updates, posters are being done. We promote colleges and universities to circulate these posts under their social media handles or display them on notice boards or walls. Apart from on-ground activities, various online activities like panel discussions, cultural events, speaker sessions, competitions have also been conducted. Panel discussions with the DC-DM regarding NMBA is conducted. Monthly e-newsletter is being released. It includes updates on the activities and initiatives taken by the state under NMBA. Training for augmenting productivity and services, an online management program by the Ministry of Social Justice and Empowerment. This is available for free to everyone. It is a well-designed course on drug abuse prevention. To sensitize students, teachers, and parents on drug dependence, related coping strategies, and life skills, a school-based training program is introduced, and that is the Navchetna module. Under the National Action Plan for Drug Demand Reduction, 582 institutes are funded for identification, counseling, treatment, and rehabilitation of substance users. These grant-in-aid institutes include de-addiction facilities providing 30 days inpatient counseling, treatment, and rehabilitation services at Integrated Rehabilitation Center for Addicts, addiction treatment facilities set up in government hospitals, comprehensive de-addiction and counseling services under one roof, named as district de-addiction centers. At these centers, treatment is strengthened through primary screening and assessment, medical treatment and referrals, individual and group counseling, recreational activities, family counseling, follow-up, and aftercare. Other GIA under NABDDR are community-based peer-led interventions and outreach drop-in centers. CPLI is established for early drug use prevention among adolescents through youth peer educators. Outreach and drop-in centers are established to create a safe and secure drop-in centers for youth where they could get better counseling and referral to treatment and also a follow-up care. All these grant-in-aid institutes are geotagged for easy identification of the available facilities at your surroundings. This holistic strategy of building a drug-free country has been appreciated by the Honorable Prime Minister Shri Narendra Modi ji in the 103rd Mann Ki Baat episode. To learn more about the NMBA and receive updates on activities, please follow link on QR code. I would like to conclude this presentation by saying that let's work together to achieve Nasha Mukt Bharat. Thank you.
Thank you, Sojourner, for such a comprehensive presentation. I would now like to call upon Dr. Victor Paul and introduce him to our audiences before requesting him to take over the panel discussion. Dr. Victor Paul is the director of the Center for Social Action, which is the outreach wing of Christ University, Bangalore. He is also serving as a professor at the Department of Sociology and Social Work at Christ University, and his interests lie in community organization and development, human resource development, elderly care, project planning and management, and elementary education. His areas of project interventions include early childhood care and education, elementary education, community health, vocational skill training, and livelihood programs. He has published several articles and evaluation reports related to the development sector. Dr. Paul is a graduate of economics and law and also holds a master's degree in social work and a PhD in sociology. He brings with him 38 years of vast experience in teaching, academic management, and development programs implemented by national and international organizations. We are deeply honored to have you here, sir. And I would now like to request you to take over the panel discussion.
Thank you, Ms. Anushka. Good morning, fellow panelists, officials, NMBA functionaries, teachers from various institutions, colleges, schools, students, and participants. As part of a month-long observation of International Day Against Drug Use and Illicit Trafficking, Nasha Mukt Bharat Abhiyan, the flagship campaign of Ministry of Social Justice and Empowerment, and many other institutions in our country have planned several activities in this month. This webinar is one such activity that will discuss the topic engaging university students to lead the drug use campaign, aiming at creating awareness and building capacities among faculty, students, and community members at large. The UN Assembly observes 26 June as the International Day Against Drug Abuse and Illicit Trafficking, as an expression of its determination to strengthen action and cooperation to achieve the goal of international society free of drug abuse. The UN has embraced the International Days as a powerful advocacy tool. In the Indian context, this day holds a particular importance due to the country's unique challenges and several ongoing efforts to combat substance abuse and drug trafficking. As you know, India faces a complex problem with the substance abuse, including the abuse of both legal and illegal substances. Factors such as socioeconomic conditions, geographical location, and social stigma play a crucial role in prevalence and patterns of substance abuse in our country. The World Drug Report also highlights, through improved research and more precise data, that the adverse health consequences of drug use are more widespread than previously thought. It provides a global overview of the supply and demand of opiates, cocaine, cannabis, amphetamine, type stimulants, and new psychoactive substances, NPS, as well as their impact on health. As we all know, protecting children from widespread prevalence of such substance abuse is one of the biggest policy challenges that we face. The immediate need is to consider how children should be sensitized, having due regard to the age and stage of the child, to the dangers of drug use, the necessity to report drug use, and the need to develop resistance to prevailing peer and social pressures. So today, on this occasion, we have 5 eminent academicians and resource persons with us who have implemented several activities and sustainable interventions in their own institutions, demonstrating their commitment to the cause, especially in the areas like substance use, prevention, treatment, and rehabilitation, integrating drug prevention into the curriculum, etc. They will talk about their experiences in implementing student-led initiatives and various student support systems, highlighting success stories and campaigns in their respective universities, institutions to make their campaigns drug-free. So each speaker will get 3 minutes in the first round to speak about their work experience in this sector. After that, each one of the speakers will get 3 to 4 minutes to answer some of the questions facilitated by the moderator. So first, let me call Dr. Nalini Ranganathan, who is a professor from Central University of Pondicherry University. Dr. Nalini Ranganathan is a gold medalist in PG program of social work and PhD from the Department of Social Work, University of Delhi. She has over 7 years of industrial experience as an HR professional. She has published several books. Professor Nalini was the first head of the Department of Social Work at Pondicherry University and served 2 full terms. She is a certified trainer of POSH Act 2013. She was the chairwoman of Confederation of Indian Industries, IW, and Puducherry, chairperson of the Child Welfare Committee, Yanam, Puducherry, and a member of several government committees. Over to you, Dr. Nalini Ranganathan.
Good morning to all of you. Thank you, Professor Victor. And keeping in mind the time limit, I'm straight away going to my presentation. Sorry for, I'm missing out on the pleasantries. And this 1 year, we have started our work for the past 2.5 years now with regard to substance abuse prevention. Our clear strategy has been prevention and plugging the demand. Why I'm saying this is Pondicherry, as rightly pointed out in the 2019 survey, is a very dismal picture because for every 100 people who consume alcohol in Pondicherry, 48 of them are using it on a dependent pattern. So it is a very high risk behavior. And as we all know, like how it affects families. So Pondicherry is already having a lot of other social problems. And based on certain surveys, we initiated our work on substance abuse prevention. Our strategies, as I'm sure many of the universities would have done, we wanted to take into our fold all the stakeholders. We wanted a multiple stakeholder intervention because the focus was on HEIs, higher educational institutions, community, and in the community specifically the women and the youth. So we first started with conducting workshops. We conducted the first 2 workshops with the faculty members, and then we realized that we needed a strategy change. Because initially we had thought that we will just ask for students at random and cover 200 to 300 students and take them in for their support to working in various communities. But we changed the strategy after the first 2 workshops, and then we went to 10 colleges in and around Pondicherry after identifying 10 communities in and around Pondicherry for intervention using the student peer educators. And we also involved community level workers, which means we also trained community level workers in all these 10 communities, which meant police, the NGO people, school teachers, Anganwadi workers, and the non-teaching staff of the respective institutions. We also conducted workshops exclusively for the non-teaching staff of these institutions. And I would like to specifically mention here, apart from school students and the faculty, when we spoke with the community level workers and also the non-teaching staff after the workshops, we always invariably had a lot of women coming to us and telling us that they need help in de-addiction process, and they needed some community-based sustainable interventions, because the rigid de-addiction centers were a problem in accessing. So that was one major learning that we had. And we also conduct, after these workshops, in 10 different colleges, in 10 different communities, our strategy was, we almost covered 1,400 students in this process, from which we identified around 70 volunteers for our student-based community educators program. And we trained all these 70 volunteers for 5 days intensively to work on community-based prevention. And we trained them in street theater, we trained them in what is substance abuse, how it is a family disease. And using these these 70 student peer educators, we made around 120 to 130 community visits continuously, engaging with the community. And we identified, here I would like to mention another strategy that we followed: positive deviance leaders, PDLs. PDLs are usually used in healthcare, but we thought that we'll use the concept of PDLs here. And this really helped us. We started off right from identification of our project resource team, which we worked as a project. And our project resource team, are all of them are positive deviant leaders. And we started identifying PDLs from every community. And we also, PDLs means somebody who has already been, is now in abstinence. They have been abusing substances. They are in the treatment process, and now they are away from substances. So we took their help in reaching out to communities. Like, for instance, if you do a street play on awareness, we will take the story from how their life is now, how their life is turned a new leaf, and that will be the focus of the street play. So like that, we also had one very important thing which I missed is, in all these 10 communities, we also had KAPs, that is the survey on knowledge, attitude, and practice of substance abuse. And we have covered around 928 respondents, and the data is ready with us. And again, going by the time paucity, I would like to conclude that now currently our focus is with these student peer educators, community-based, whichever college, whichever institution, be it schools, be it colleges, calls us for a session on substance abuse prevention, it will be these student educators who will lead the discussion. They go there, they either do a small street play, or they conduct the session, because as the sessions are very interactive. We start off with questions on what they understand about alcoholism, or for that matter, substance abuse, how it affects the body, how it affects families, their myths. For this, I really thank the NMBA, because we took a lot of information from the NMBA PowerPoints that were there. We didn't have to reinvent the wheel. It was very useful to go back to the NMBA website and take a lot of information from there. So that way, it has been a very good inspiration for us. And currently, as an important outcome of this entire work of the team, we have 2 PhD scholars who are working on this. Plus, now, since the survey has pointed out towards more sustainable interventions, we are now, I'm happy to inform you, have been funded by ICMR to do research involving the public health facilities and the PDLs for treatment, for sustainable interventions on substance abuse prevention. And with that note, I think before Professor Victor Paul intervenes, I'm concluding here. Thank you very much for this opportunity.
Thank you, Dr. For that excellent presentation. Especially you mentioned about the strategy for substance abuse prevention, various strategies, and also multiple stakeholder approach. And interesting thing was community-based sustainable intervention, especially the positive deviant leaders, how you make use of them. And we'll get back to you on some of these areas after this first phase. Now let us go to Dr. Anish KR, who is an assistant professor with Rajagiri College of Social Sciences, was also former HOD of Rajagiri College of Social Sciences, Social Work Department. Dr. Anish has about 22 years of teaching experience in social work education. And also he is the project director for Rajagiri Community-Based Action for Drug Prevention project. Also resource person for several associations, and especially CPLI and ODCI of NISD. also district coordinator of Nasha Mukta Bharat Abhiyan of Ernakulam district. In fact, Ernakulam district is one of the best districts which has several models, several methods they have adopted for prevention of drug abuse. And he also held various positions as chairman of board of studies in several universities and colleges, a member of POS in more than 7 colleges. He has several major research projects, grants, fellowships, and consultancy services to his credit. He is also the founding member of Kerala Association of Professional Social Workers and also CAPS Skills Academy. He initiated the formation of CAPS as General Secretary of the Association of Schools of Social Work in Kerala. Over to Dr. Anish.
Thank you, Professor Victor. Thank you, NMBA, for this invitation to be with you on this occasion of observing the Day of International Day Against Drug Prevention. We know that as education institutions, we have responsibility to work in the community. I bring greetings to you from Rajgiri College of Social Sciences. And with the focus of demand reduction, we have initiated a project as part of after reviewing the All India Institute of Medical Science study and the NMBA initiation of NMBA. And Ernakulam district, our district was considered to be one of the districts among the 276 districts identified as most vulnerable for drug abuse and prevention. So because of that, we have initiated a program. The program was focused on prevention, theories of prevention, as well as community organization of social work principles. And we have kept sustainability in our mind. So when we started the project, we have had programs thinking about from initiation phase to action phase to sustainability phase. So in the initiation phase, we have tried to have maximum participation of the community, keeping the sustainability component in mind, where we identified 10 partnership villages in the community next to our education institutions. And we have introduced this concept to all our students with the dual intention that our students should not be using drugs, and also they will be ambassadors of drug prevention in the society. So we identified the partnership communities. We have stakeholder meetings with all the local self-government and all key persons in the community. Starting from there, we developed community committees in the local within the 10 identified villages, where we have identified 100 community executives. They were from the community who are interested in acting and working for the community prevention activities. So we identified the community executives. Then we offered orientation and capacity building program for all these community executives along with our student trainees. And it was integrated to the fieldwork activities of social work students. Now, after the students are trained, after the community executives are ready, we have done a community level mapping exercise. We have done the vulnerability and risk mapping in the community with the help of the community volunteers as well as with the expertise of students, trainees, and they've done the vulnerability mapping. We also did a social mapping which identified the hotspots and other major areas where drug is being used. So based on the identification, we have tried to plan for intervention in each of these communities depending on their vulnerability, depending on the risk factors, and also identify the protective factors. So based on that, we developed a series of IEC materials, short videos, posters, leaflets, and other things. And with the support of community executives, especially using all the community structures, we developed programs with the support of Kudumbasri, which is a women empowerment program in Kerala, youth clubs, residents associations, workplace interventions, with the Anganwadi teachers and other people, including for adolescent girls and mothers in the Anganwadi centers, schools and colleges. So we have done more than 100 programs in the community to equip people, make people to understand about basically about the various risk factors associated with drug abuse and prevention. In that process, it was focusing more on primary prevention. When we have identified hotspots and areas where people are more vulnerable to develop, so we have developed indicated intervention where small group interventions, small group discussions, such things were conducted in local communities so that people were attracted towards seeking services. So we also developed a web form. After every assessment in the intervention program, we developed a web form where people can go online and assess their risk of using the assist tool. We developed a web form which people can go online and assess their risk and identify the risk factors and where do they stand with regard to the risk. Especially with youth and adolescents and college and school students, they were able to do that. It was both in English as well as in Malayalam. And they were able to assess, and at the end they got information about treatment and facilities where they can go and seek support if they are in risk. So that information was the end point of this particular assessment. So we were helping them do that. And we also done various awareness generation programs and competitions, schools and institutions like that. Vehicle rally was done, flash mobs were conducted, street plays were conducted. And one of the important thing was we never stopped with the primary prevention. We focused on secondary prevention for early identification and referrals. So we made a list of organizations available for service delivery so that people were able to seek service of IRCS, our family counseling centers, ODIC and CPLI, which our institution runs to ODIC and CPLI program in the community. And also we were linking people to the Vimukti treatment centers, which is the initiative of the Excise Department of the State of Kerala. So we were linking them. And basically all these, those were actually gone through treatment, were also linked to AA and NA groups. So basically, we have developed a standard operational procedure of conducting how to conduct a community-oriented intervention for prevention of drug abuse, which was named as Rajagiri Community-Based Prevention Action Plan for Prevention, where we have developed a SOP how to intervene in community for NSS volunteers, for NCC volunteers, and things like that. Along with that, we have also developed a document, a fieldwork guideline for fieldwork, integration of community-based prevention activities of drug prevention into fieldwork activities, social work institutions. That was actually introduced, done with workshop with experts, as well as gaining feedback from our own practice in the community. We started with the training volunteers, then getting them doing the survey and mapping in the community, intervening in the community, providing case or group work service in the community, and also intervention training. These are the nutshell of the activities we have done as part of NMBA. And I will be happy to answer to any questions if you have. Thank you.
Yeah. Thank you, Dr. Anish. In fact, for that comprehensive presentation of a model you mentioned about, especially on demand reduction and also sustainability factors that you kept in mind from the very beginning. And students as ambassadors, it's another aspect which is the highlight of your presentation. And also community committees for support and capacity building of communities, and also the web form that you developed to assign the risk, and also focusing on secondary prevention. So we'll get back to you with some of these aspects. Now let us go to Dr. Geeta Maya, next speaker, who is the Director of Student Affairs and Professor of Department of Computer Science and Engineering, Manipal Academy of Higher Education at Manipal, Udupi district. Dr. Geeta Maya has been working with MAHI in various capacities for the last 21 years, more than 21 years. Dr. Geeta has numerous publications in both national and international journals with her fields of expertise including data mining, database management systems, data structures, and algorithms and graph and lattice theory. She has also presented papers at various national and international conferences, chaired several conference sessions, and received Best Paper Awards for some of her presentations. As Director Technology of Student Affairs at MAHI, she has been instrumental in organizing and implementing all student-related activities, workshops, awareness programs, student counseling, and grievance redressal. She was also a member of the team that played a crucial role in establishing Manipal University in Jaipur in 2011. Over to Dr. Geeta Maya.
Thank you. Very good morning to all of you. And greetings from Manipal Academy of Higher Education. Manipal stands as an institute of eminence distinguished for providing education to a diverse cohort over 33,000 students hailing from various corners of the globe. The Department of Student Affairs MAHI plays a pivotal role in providing holistic learning environment to all these students. So whenever they face challenges, so we are with the support system going to help them. So as you all know, substance abuse is a major problem. It's a worldwide problem. So we have been working on this from the past for several years. So now, ages of Nasha Mukt Abhiyan, Nasha Mukt Bharat Abhiyan, Ministry of Empowerment. So we have started our project, that is Nasha Mukt Udupi Abhiyan, by involving young leaders of MAHI. So with the objective to sensitize the students and residents of Udupi district and also create awareness among the people about the repercussions of substance abuse and legal implications, and also create secure and holistic learning environment for students. So with regard to this or with these objectives, so what we have done is we started our project, and initially we selected staff and students of different institutions of MAHE, and we have conducted training we have given training for them, even training for the students with the eminent resource persons. And then after training with help of these students, so we have conducted several educational initiatives such as seminars, talk series, radio talk series, webinars, and also we have conducted workshops, marathons, walkathons, competitions, and also we have educated we have empowered our educators to enhance their counseling skills to identify the students who are having the problems. At the same time, our students, so they are the ones, they see their peers from very close. So because of that, we have launched Nasha Mukta Club in all institutions of MAHE. At the same time, we have launched Peer Support Club in all institutions of MAHE. Peer Support Club, the main objective of this particular club is to identify the students who have problem at an initial stage. So as you all know, with the problem, small problem that aggravates without, if they don't take any help from the people. So because of that, this is the duty of our students. They are very close to their peers, so they want to help their peers. So they are the ones, they are the part of that particular club, and they are going to conduct awareness program, and also they identify them and they would let us know. Some students, they don't want to reveal their identities. So with regard to that, so we have a support system called anonymous reporting system. So students are the ones, they are actually writing the details in that particular system, so that we would come to know the students who are having the problems. It is not necessary that they have to be into substance abuse or anything. So if they have any problem, they would report to us, so that, and our counselors, MAHE student counselors, they take care of them, they talk to them. In case required, they will refer them to our clinical psychology or psychiatry department or student support center of MAHE. So this is what exactly, and they, even if required, they treat them, and then that's how we are going to transform them. So, and in addition to all this, we have also started, framed one syllabus that is called as curriculum for all the students, that is called as life skills course. Because during this journey, we came to know what are the problems our students are facing, and they are finding it very difficult to accept failures. So that is why we thought this particular course will help them. So how to accept failures, how to overcome their problems. So all these things are mentioned in this particular 6 credit online course, and is going to be mandatory for all students of MAHE. At the same time, this is like just about our glimpse of the work which we have been doing. That's what I'm telling you. And this is in-house program. At the same time, what we have done is we have surveyed 20 villages and conducted and identified 10 hotspot villages. So wherein we conducted door-to-door survey as well as visit, and we conducted awareness program, competitions, and also marathon, walkathon, and also we have conducted medical camps, dementia camp. So many medical related things we have done. And then after that, so we have even visited public places like fish market, and also we have conducted program in de-addiction camps. So all these things we have done, and of course, all this we can do because of our MAHE leadership support. At the same time, we have meetings, support from local government bodies, NGOs, and of course Anganwadi and Asha workers, because all these people, Anganwadi and Asha workers, we have trained them, so they are helping us a lot. So with all these, like what we could achieve is so many students, like more than 150 students, they are transformed, and we could reach more than 57,000 students. So all these activities are all because of our led by our students. So that highlights their commitment and also leadership. So that is what exactly I want to tell. So now this is that exactly, or I can say, glimpses of the activity which we have done for the community as well as the students of MAHE. Thank you.
Yeah, thank you, Dr. Geeta Maya. In fact, some of the specific features are in your, especially Mahi, holistic learning environment for student. That is something which was the highlight of your presentation. And also young people of Mahi, NMUA, Nasha Mukta Udupi Abhiyan. That is another thing which you mentioned. And training for staff and counseling skill for every staff, educational functionaries. And also peer support club. That is another special thing that you mentioned about. These are some of the best models which others can also follow. And anonymous support system, which is another aspect, and also curriculum for life skills, curriculum in life skills, which is 6 credit course, and also involving public, especially Anganwadi workers, and especially whoever working with the public at the grassroots level. That is another feature of your activities. Now let us go to Dr. Ashutosh Pradhan, who is a professor at the Department of Social Work, Central University of Himachal Pradesh. Sir has about 32 years of teaching experience, and he is a resource person in several universities and institutions, and he did special lectures at JNU, Delhi, Jammu University, Central University of Jammu, Utkal University, Bhubaneswar, Sambalpur University, Teachers Training College, Dharmasthala. He also has 3 years of NGO experience. In his 32 years of career, he served in various positions at several reputed institutions in our country. Some of them include Executive Council member of Central University of Himachal Pradesh, member of Board of Studies and Academic Council in various universities, former head Department of Social Work, Central University, SP, former head Department of Sociology and Social Anthropology in Central University of Himachal Pradesh, former Dean School of Social Sciences at Mahatma Gandhi Central University, Bihar, and former head of JVBI, Jan Vishwa Bharati Institute at Himachal Pradesh. And Sir has served in 4 states, and he is also a member of several social work associations. Over to Dr. Ashutosh Pradhan.
सभी को नमस्कार. It is indeed an honor to some of the activities of the Department of Social Work, the Central University of Himachal Pradesh, involves the observations that and experience that I have had in the past 30-35 years. Our university is Himachal Pradesh and neighboring Punjab, and all of us are that it is a drug addiction. Substance misuse is a huge problem in this part of the country. From the beginning itself, when the university was established in 2009-10, some of the faculty members indeed particular and included one as part of our master's program. And since 2010, we have been continually offering this particular book for our students. As part of this abhiyan, we have both faculty and students, and also people of neighboring areas have contributed to the Nasha Mukt Bharat Abhiyan. In grade in and around university, in the villages, in the nearby towns, and also all of you are aware that Himachal Pradesh is a tourist destination, as a result of which a lot of people from different parts of the country come to this place. And it is so important that we contribute to awareness building of the communities, the youth masses around, so that they become conscious and cautious as to how this problem can expand and can be negatively lives and livelihoods, not only individuals but also the families. We have been organizing on a yearly basis various programs as part of our regular field. Our students, as others have also mentioned, have been involved in designing and developing awareness campaigns through different media. And we have been placing our students for their job placement or internship at the during the summer vacations, and also some of the students they themselves opt to work in such organizations which are working especially in the field of drug de-addiction and substance abuse prevention, harm reduction. In this part of the country, there are a lot of drug de-addiction centers. Our students visit these organizations of observation visit, and also many of them are placed in some of these drug de-addiction centers. They get job placement, and we also visit these centers and come to know a condition of the inmates who are people who are staying there. And on our part, we try to give a feedback as to what should be the minimum standards that they should be maintaining. In fact, you would be pleased to know that one of our alumni, he has started his own drug de-addiction center, and there is another student who is making efforts. She will be starting her own drug de-addiction center. So we are hopeful that we will be whatever we have been doing over the years in the past two decades of one or more decade. I'm sure that we would be expanding our work further. Our faculty are involved in training the train as for DOT. In Dhamshala, we have a regional training center, RRTC, and our faculty members they go there and deliver lectures. And also, whenever we get an opportunity, we visit an ISD to train ourselves. So very recently, I had even at this also, I had gone to an ISD to take training so that we are abreast of the times. A lot of work has to be done, especially in curricular design and also in the field of research. We encourage our students to do that in this sector. One of my PhD research scholars, prevention. Of course, there is a danger that it may develop a curiosity, but ample care is being taken as to how to check this. One of my PG students also, she is working in this field and is conducting research and submitting her dissertation. We have also conducted certain experiments in the form of education and taken feedback of the students also in order to what is the opinion of the especially in the university system, and how we can involve them in this process of substance abuse prevention, and also how to prevent the harmful of drugs. We have conducted on the basis of Ministry of Social Justice and Employment and various other institutions. We have launched signature campaigns in the community, but also by actively with the panchayats and in some of the tourist places, Inshallah, Manakul, Mali. Also, we have gone beyond the Atal tunnel, and that also we have tried to raise awareness and visitors, especially who are coming to this place. So whenever we go for such a signature campus, people are surprised, and they started and they start to inquire about what is the situation like in this particular state and this part of the country. We conduct seminars and workshops on a regular basis as part of our regular activities. Sponsored or collaborative seminars and workshops were conducted in the past with IST and people from across the country. They have participated and contributed. We also took played an active role in conduct of a half marathon in October 2023. I think whatever has been our stake in this particular field, we have been able to sincerely try and contribute.
Dr. Can we conclude?
We move ahead and create a healthy society, especially raise awareness among university student community and also among the general public, so that we lead a healthy life. One last word. I have some experience of talking to some of the parents. They have shared their pain as to the stigma that they have suffered. All that because somebody in the family has been to drugs. Their relations with their relatives, friends, neighbors, community members, and one particular parent, he felt so sad at what mistake or what crime have we committed, or I as an individual have committed, that we have to face this sort of challenge in this part of the life, in later stages of life. So, for giving this opportunity, sure, we can do a much better and more creative job in the future. Thank you.
Yeah, thank you, Dr. Ashutosh. You spoke about activities that you are conducting with much difficulty, especially the difficulty regarding the terrain. And also you mentioned about one interesting aspect was your focus on tourists who are coming to Himachal and your training programs for them. And also summer vacation programs is another highlight. And students associating with de-addiction centers and students themselves starting de-addiction centers, model de-addiction centers. These are some of your highlights, and also faculty involvements in the program. Thank you, sir. I would request all of you, all the panelists, to remain on screen. Switch on your camera. Let us go to Dr. Apurva Saha, who is an associate professor with NIMHANS and also the HOD at Department of Social Work, Tezpur University. He did his doctorate from NIMHANS, Bangalore. Dr. Apurva Saha has more than 17 years of experience in various positions with several institutions like Department of Psychiatric Social Work, LGB Regional Institute of Mental Health, Tezpur, Psychiatric Social Worker, Department of Psychiatric Social Work, NIMHANS, Bangalore, District Extender with West Bengal State Immunization Support Cell in collaboration with the UNICEF, and also Council for Advancement of People's Action and Rural Technology, Kapat, New Delhi. Dr. Apurva Saha has several, research, mainly his research interests are social work and mental health, psychological care and disaster management, suicide, substance use, abuse, street children, and application of social work methods. He has managed several funded research projects and consultancies. Over to Dr. Apurva Saha.
Thank you, Professor Victor Paul, respected panelists, and the team NMBA. A warm welcome from the Department of Social Work, Tezpur University. Tezpur University is a central university which is situated in the north bank of Brahmaputra. Before going to my actual activity, I'll give a brief background about this area and the university. This is a residential university with about 5,000 student capacity. We have 4 different schools like School of Engineering, School of Sciences, School of Management, and School of Humanities and Social Sciences, along with the faculty. So altogether, it's around 6,000, more than 6,000 population in this area. So the substance abuse is one among the evil in our society, and youth is one of the victim of it. We all know that youth are the backbone of our society, but they are in the provocations of these substances. So in Northeast India, it's a very strategical point, starting from the geographical locations and the variety among the populations, the culture and the Western influences, the indigenous culture. So the substance is one of the part of their indigenous culture and the systems. And people in this area already are consuming and highly influenced by the alcohol, cannabis, and the smokeless tobaccos. That's why the oral cancer is very high, prevalent in all over India in the Northeast. So with this background, the Tezpur University Department of Social Work initiated Nasha Mukt Bharat Vision, one of the flagship program of the Ministry of Social Justice and Empowerment, with collaboration with NSS unit of Tezpur University. Let me tell you that we have a very big NSS unit, around 1,000 volunteers. I'm also part of this NSS volunteer group. So to start with our program, like we started long back during the COVID period when physical activity, conducting a physical program was very difficult. So we started with the webinar. So we conducted webinar with the different panelists from the NMBA and LGB and other mental health institution on the drug abuse in Northeast India, also substance use abuse among the youth, a biopsychosocial perspective. So that was the starting point of our initiating this program. And what we did is then we formed different Nasha Mukt club within our university. As I mentioned that there are 4 different schools. So we have formulated 4 different schools of Nasha Mukt club in each school. And then we trained those volunteers, like each group consisted of 20 members. And we did a kind of induction training program for those 20 members. And those 20 members educated the entire school, conducted several awareness programs within their own school, like science, engineering, humanities, and the management. We have established a drug counseling center in the university with a different name called, like, to avoid the stigmatization on the substance abuse and the drugs. So we call it a counseling center for preventing unhealthy behavior. So that was the name, and we managed with the volunteers, those who are trained with the mental health aspects. We have conducted training of trainers, that is master trainer. Those trainers, different volunteers who has initiated several activities such as poster making competitions, slogan writing competition, quiz competitions, and rally on substance abuse within the university campus. We also have several awareness program we conducted in the school setup with the volunteer resource persons. And we also did street play. Through street play, we tried to create awareness within campus as well as outside the campus. So, and that was a kind of activity we have initiated from our university's social responsibility. Our future plan is to venture into the other higher education institution like Tezpur, where the university is situated. There are other colleges, and the substance is quite prevalent on those areas. We thought of going there. And also we have a plan to build capacity for the frontline health workers, school teachers, Anganwadi workers, ASA workers, and other people. We also thought of initiating the village adoption program. Along with the ministry's Nasha Mukt Bharat Vision program, we also connected with the another Nasha Mukt program is initiated by Minister Kaushalka, Nasha Mukt Bharat Vision Kaushalka, who also has visited physically to Tezpur University, and we also have a like awareness program with his help. So in conclusion, I'll say effective drug education became very important for this younger generation, since we are talking about the role of educational institutions and the substance abuse in this World International Day on the drug abuse. So education can play a counterbalancing role in shaping a normative culture of safety, moderation, and informed decision making. Engaging students in drug education activities assists them to make healthy and safe choice, identify risky situations, and develop strategies to prepare them challenging situations. Educational institutions provide a rich environment to shape attitude, behavior, and help youngsters remain drug-free. I believe that together we can create a profound, lasting impact on lives of our students and the future of our nations. By embracing the Nasha Mukh Bharat vision, we commit ourselves to higher purpose, to shape responsible citizens who will lead by examples and inspire others follow suit. I call upon each one of you to join me in this transformative journey towards the drug-free India. Let us work together hand in hand to build a society where the dreams of our youth are not compromised by the shackles of substance abuse. Jai Hind. Thank you, sir. Thank you for giving me the opportunity.
Yeah. Thank you, Dr. Apurva Saha, for that brief and concise presentation. Also, you mentioned about how to deal with substance use, especially with indigenous culture, and also involvement of NSS. That is another model that you follow. And also starting NMBA clubs in your university, and also as part of social responsibility of the university, undertaking capacity building programs, village adoption program, and especially skill development program. So thank you, Dr. Apurva. So now our initial plan was to have some questions, but I'm afraid that now almost, I think it's 12 o'clock now, we may not be able to, question answer session. So we will directly now conclude this. And so as most of you expect, on this day of observance of International Day, many of you mentioned about campaigns, especially media campaigns, including social media, TV, radio, and also, various posters, pamphlets, and public service announcements, etc., as part of campaigns. Also, some of you mentioned about several educational programs, curriculum development, and also workshops, seminars, lectures, education institutions as part of their social responsibility, undertaking capacity building programs, and various models you mentioned, different models, and also discussion on legal implications. Some of you mentioned about and health impacts. Another area that focus given was community engagement, especially some models on local community committees, leaders, celebrities, involving them, and influence on participation by community, grassroots level community members, local NGOs, involvement of local NGOs. Another area which we covered was healthcare initiatives, health checkup camps, and de-addiction centers. One model that as Christ University Bangalore we have taken up is police marshals. In association with the police department, we trained students as police marshals to support their initiatives. There are various models and also student clubs. So to conclude, this International Day against and illicit trafficking serves as a crucial reminder of ongoing battle by all of us, especially the ministry and all the education institutions against substance abuse in our country. By raising awareness, promoting education, and enhancing cooperation, we continue to make strides in addressing this pressing issue. The collective efforts of our NMBA team, the government, NGOs, healthcare providers, and the community are very vital in creating a drug-free society. Moreover, as all of you mentioned about the role of teachers and professors that plays a pivotal role in this initiative. So by leading students by example, I think various type of interventions, and we can reinforce the importance of a drug-free lifestyle. And as educators, we can also integrate discussions about drug prevention into our curriculum, as some of you already mentioned, and actively participate in campaign activities, demonstrating our commitment to the cause. So the mentorship and guidance that you provide to students, especially I think in one of the presentations you mentioned about the knowledge, attitude, and the practice behavioral aspect, which provides a strong support system to encourage healthy choices among students. So I take this opportunity to thank the Joint Secretary, Ministry of Social Justice and Empowerment, Ma'am Radhika Chakravarti, Ma'am, and the entire team at NMBA for organizing this wonderful webinar and allowing us, the panelists, to express our thoughts and share our experience. Thank you very much. Over to Anushka.
Thank you.
Thank you, sir. Thank you so much. I extend my heartfelt thanks to our moderator, Dr. Paul, as well as all our panelists for their invaluable contribution to today's discussion on the role of universities in implementing the Nasha Mukt Bharat Abhiyan. Your expertise and insights have provided us with a deeper understanding of how educational institutions can lead the fight against substance use. Your dedication to this cause is truly inspiring and instrumental in driving the change in this country. To our audience, your active participation and willingness to share your experiences and time has enriched our conversation. Your engagement highlights the collective commitment we share in creating a drug-free India. Together, the combined efforts of our academic institutions, experts, and community members are pivotal in ensuring the success of Nasha Mukt Bharat Abhiyan. Let us continue to work collaboratively, leveraging our strengths and resources to make significant strides towards a healthier drug-free India and this society. Thank you once again. I would like to thank our panelists once again. We have been deeply honored and for your time that you have given us. Thank you so much.
Thank you. So we are concluding, right? Yeah, thank you.
Yes, sir. We look forward to further collaborations in the future. And once again, thank you for sharing the thoughts.
Thank you all once
We
again.
would-
Thank you. Thank you.
Yes,
Thank you.
we would end this webinar.
Thank you. Thanks a lot.
Thank you.